Welcome to the Explainer. Okay, so today we're tackling a condition that can be, well, incredibly painful and super frustrating: the frozen shoulder. Maybe you've had it, or you know someone who's gone through it. Their shoulder just stops working, locked in pain. We're going to unlock what that really means and get into why it happens.
Right, so let's get into it. Why does the shoulder just suddenly freeze? What is actually going on inside that joint when it loses its range of motion and gets locked in pain? It's a huge deal. And figuring out the why is, well, it's the first step to getting things moving again.
Okay, so first up, let's talk about the name. It might seem like we're splitting hairs here, but what we call this condition actually matters a whole lot for understanding what the real problem is. So on one hand, you've got frozen shoulder. And yeah, we've all heard that term. It perfectly describes the symptoms, right? It feels stiff, painful, totally stuck. But the actual medical diagnosis, the thing that's causing all that trouble, is adhesive capsulitis. Think of it this way. Frozen shoulder describes the feeling, but adhesive capsulitis describes the cause. It's like saying you have a headache versus getting a diagnosis of a migraine. See the difference? So, who does this usually happen to? Well, the key demographic here is people between 40 and 65 years old. So we're talking about people right in their prime working years. And interestingly, for reasons we don't totally understand, women are more likely to get it than men.
All right, let's get into the nitty-gritty of what's happening inside the shoulder. Your shoulder joint is wrapped in this, think of it like a flexible envelope of tissue called the joint capsule. Now, with adhesive capsulitis, that capsule gets inflamed. It starts to thicken up and tighten, and then scar tissue or fibrosis forms. It's literally shrinking and sticking to the joint. Just imagine that nice flexible lining suddenly becoming all thick and sticky. That's the heart of the problem.
And to put that into perspective, check this out. A healthy shoulder capsule can hold about 10 to 15 milliliters of fluid. But in a shoulder with adhesive capsulitis, that space can shrink down to just 3 to 4 milliliters. I mean, that is a huge reduction in space. No wonder you can't move. It's what physically stops the shoulder from doing its job. Okay, so how does a doctor know for sure that it's adhesive capsulitis and not, say, a rotator cuff tear or something else? Well, the answer is pretty cool, actually. It's all about a very, very specific pattern of stiffness. And here's the biggest giveaway for them. It's what happens when the clinician moves your arm for you. That's what passive means. You're not doing the work. If they hold your arm at your side and gently try to turn it outward and it just stops, it hits a wall, that is the #1 hallmark of this condition. And what's really fascinating is that the stiffness isn't random. It follows this super predictable sequence. It's like a diagnostic fingerprint for adhesive capsulitis. First, turning the arm outward is the absolute worst, the most limited movement. Next up is lifting your arm out to the side. And then finally, turning the arm inward is also limited, but not as much as the other two. This exact order is a massive clue for any clinician. So why is this pattern so important? Well, because it tells the doctor that the problem isn't with the muscles or the tendons, like a rotator cuff tear. No, it points right to the joint capsule itself. It's the whole envelope that's the problem. And knowing that helps them differentiate it from other issues. It helps everyone avoid unnecessary tests or treatments. It just gets them on the right track faster. All right, now let's shift gears and look at what this whole journey is like for the person going through it. Because this condition isn't something that just happens and stays the same. Oh no. It evolves through these very distinct phases over a long period of time. And this timeline gives you a really good roadmap of what to expect. It all kicks off with what's called the pre-adhesive stage. This can be up to 3 months of sharp pain, a constant ache, and really bad sleep. Then you move into the freezing stage. This is where the inflammation gets aggressive and you start losing motion pretty quickly. After that, you hit the frozen stage. Here, the pain might actually start to ease up a bit, but the stiffness is at its absolute worst. And finally, you get to the thawing stage, where things slowly, gradually start to improve. As you can see, we're not talking about a few weeks here. This whole thing can easily last from 15 months to 2 years, or even longer. And here's a really crucial takeaway from all that. The experience totally shifts over time. In the beginning, it's all about the pain. But as you move through the stages, it becomes all about the stiffness. So your main focus shifts from pain management to stiffness management. And that's why knowing which phase you're in is so, so important for your treatment. So once you know what it is and you understand the journey, the big question is, what can we do about it? Well, the general strategy is what's called a step-up approach. You start with the simple stuff first and only move on to more invasive options if you need to.
And this table kind of lays out all the options on that ladder. At the bottom, you have physiotherapy. This is the cornerstone, really. It's important in every single phase. Then, if the pain is really bad, a corticosteroid injection can help calm that inflammation down, especially for short-term relief. If things are still stuck, you might step up to hydrodilation, where they inject saline fluid to stretch the capsule out. A bigger step is manipulation under anesthesia, or MUA, where a surgeon physically moves your shoulder to break up the scar tissue while you're under general anesthesia. And then at the very top, the most invasive option is an arthroscopic capsular release, which is surgery to actually go in and cut the tight capsule. As you can imagine, each step is a bigger deal than the last.
But here's the kicker, and this comes straight from the research. For all of these different treatments, there's actually not a lot of great evidence to say that one is way better than another. There's just no single best treatment, no magic bullet that works for everyone. And, that little fact makes this next part maybe the most important part of all. So what's the road to recovery really look like? What's the prognosis? And what's your role in all of this?
Well, the good news is that for most people, the long-term outlook is pretty positive. About 59% of people get back to a full recovery. But it's also really important to be realistic here. You can see that over 40% of people still have some mild to moderate symptoms, and a small group has severe symptoms, even years down the road. So it's not always a perfect 100% bounce back.
And this is where patient education becomes so incredibly powerful. Just understanding the condition helps lessen the fear. It helps you fight that natural instinct to just stop moving your arm, to guard it, which actually just makes everything worse. Knowing that you can and should move, just in a modified way, is a total game changer. You have to be an active partner in this. And that brings us to what is probably the most essential concept in all of this: shared decision-making. Because the evidence isn't black and white, the best path forward is the one you and your doctor decide on together. It's a collaborative process. You bring your values, your goals, what you're willing to do, and they bring the clinical evidence. Together, you make the call. So that leaves us with this final thought. The question isn't what's the best treatment for a frozen shoulder? The real question is, what does shared decision-making mean for you? Because at the end of the day, unlocking this condition isn't just about what's done to you. It's about the choices that you make with your healthcare team as an informed, active partner in your own journey to recovery.